Standard precautions are a set of infection control practices used to prevent transmission of diseases that can be acquired by contact with blood, body fluids, non-intact skin, including rashes, and mucous membranes. Hand hygiene is the single most important and effective method in the prevention and control of infection. Here's how to wash your hands with soap and water. Wet hands with water. Apply enough soap to cover all hand surfaces. Rub hands palm to palm, right palm over left dorsum with interlaced fingers and vice versa. Backs of fingers to opposing palms and fingers interlocked. Rotational rubbing of left thumb clasped in right palm and vice versa. Rinse hands with water. Dry thoroughly with a single-use towel. Use towel to turn off the faucet. This video will show you the different types of personal protective equipment in the Materprivate Dublin and how to properly don and doff them. Personal protective equipment, PPE, means any device or appliance designed to be worn or held by an individual for protection against one or more health and safety hazards. Aprons are worn when a procedure performed has a risk of splashing or if the patient has an infection that is transmissible via contact. Depending on the activity that you will do, you can choose between a non-sleeved apron or a long-sleeved apron for high-contact activities such as bathing or positioning. A fluid-resistant gown is recommended for patients who are suspected and/or confirmed with any global communicable disease such as COVID-19. Gloves are worn during all patient care activities that may involve exposure to blood and all other body fluid, including contact with mucous membrane and non-intact skin, and for transmission-based precautions. Goggles should be worn when there is a risk of contamination to the eyes from splashing of blood and body fluids. Masks are worn to provide a barrier to splashes and droplets impacting on the wearer's nose, mouth, and respiratory tract. A standard surgical face mask is worn as standard precaution or for droplet precaution. An FFP2 mask is the European standard equal to the North American N95 mask. This is worn for airborne precautions and for patients who are on droplet precautions who need aerosol generating procedure performed on them. What we're going to show you next is how to prepare yourself to look after a patient with a respiratory virus. We're going to show you how to don and doff personal protective equipment. Firstly, you have to make sure that you are in a safe space to put on your PPE. This could be in an anteroom or a space just outside of the patient's room. Here's how to perform hand hygiene with an alcohol-based hand rub. Perform hand hygiene as per the WHO World Health Organization 5 moments of hand hygiene. As per the 5 moments of hand hygiene, wash your hands before donning your PPE. We're using an alcohol hand rub for this. To put on your gown, ensure that your whole torso is covered from the neck to the knees, with the arms to the end of the wrist, and wrap around the back. Tie the gown at the back to avoid contamination during doffing. The next step is to put on a surgical face mask. The surgical face mask provides adequate protection for droplet precautions. Make sure that the wire is at the top of the mask. Tie a knot with the upper straps at the top of the head and tie the lower straps at the back of the head, ensuring that the mask has a good seal on the nose and mouth. We will now show you how to put on an FFP2 mask for airborne precautions such as tuberculosis, measles, and chickenpox, and for patients who are on droplet precautions who need aerosol generating procedures performed on them. Separate the straps before you apply this to your face. Put the straps over your head. The lower straps go behind the ear, and the upper straps go to the top of the head. Put the mask over your face and check that the underside of the mask fits under your chin. Ensure that there are no folds underneath to get a good seal. The next step is to do a fit check. Cup your hands together, put them over the mask. Inhale, the mask should depress. Exhale, and the mask should expand back to its original shape. Ensure that air doesn't escape around the mask. The next step is to put on goggles. Pull the straps over your head and position the goggles properly. Adjust the side bands as necessary. The next step is to put on your gloves and make sure that the glove goes over the wrist and no skin is exposed. This may mean that you might need to put on a second pair of gloves. Depending on the activity or procedure that you're doing inside the patient's room, you may need to change gloves to conform to infection prevention and control best practice standards. Ask a colleague to check that your PPE is done properly. You're now ready to go into the patient's room. We're now going to show you how to properly take off PPEs. In the Materprivate Dublin, we take off all our PPEs right before exiting the patient's room, where you will have access to a clinical risk waste bin and a hand hygiene facility. For airborne precautions, the mask is taken off outside of the patient's room. It is crucial to decontaminate your hands at any stage where you are concerned that your hands may have gotten contaminated. The first thing to take off are your gloves. These are the most contaminated PPE at this point. There are two ways to remove your gloves. First, wash your gloves with an alcohol-based hand rub and use a glove-to-glove, skin-to-skin approach. Grasp the palm area of the other gloved hand and peel off the first glove. Slide a finger or two of the ungloved hand under the remaining glove and peel off the second glove. Discard gloves in a clinical risk waste bin. Perform hand hygiene. Another way is to remove your gown and gloves together. Unfasten the gown ties at the back. Pull gown away from the neck and shoulders. Turn gown inside out and roll into a bundle, including your gloves. Discard these in a clinical waste risk bin. Perform hand hygiene. The next step is to remove the goggles. The front of the goggles is potentially contaminated. Remove the strap of the goggles from the back of the head by lifting the band. These goggles are reusable. Put on a fresh pair of gloves. Wipe the goggles with Clinell wipes, ensuring a 60-second contact time, and let dry. Remove your gloves and perform hand hygiene. The last PPE to be removed is the mask. The front of the mask is potentially contaminated. Grab the straps from the back of the head and remove the mask. Discard this in a clinical risk waste bin. Perform hand hygiene. If at any stage of removing your PPEs, you contaminate your hands, perform hand hygiene properly, and this inactivates the virus.